Hey, it's Dave here, and we're on to another video where we're just discussing the relative benefits and drawbacks of medical testing for digestive health. And in this particular video, we're going to look at ultrasounds. And so many of you have probably had ultrasounds. They're used in pregnancy, they're used to check cardiovascular health and many other elements of health. They're not limited just to the digestive system. But we want to specifically focus on their use in discovering and identifying digestive problems. And so there are a couple of different types of ultrasound. There are external ultrasounds and there are internal ultrasounds. And with an internal ultrasound, it's kind of like putting a probe inside the body or on an endoscopy. And what happens with the ultrasound is it gives off high frequency sound waves, and they bounce off structures in the body. And they create an image on a screen. That's the simplest way to look at it. And from that image, you can find things like blockages, cysts, stuff that shouldn't be there really in the body. And so the ultrasound's really good for finding structural problems and things where the structure of the tissue, of the organ systems have actually changed. And so things really need to have progressed quite a long way in the disease process before an ultrasound can find them. This ultrasound method is no good for uncovering what's going on in terms of a functional digestive disorder. And if you remember what a functional digestive disorder is, it's where they do all of these tests and they can't find any structural problems. So somebody feels really unwell, has lots of digestive symptoms, but they can't actually find what's called an organic reason for that. There's no real evidence from colonoscopies, endoscopies, ultrasound scans and things that there's anything going on. But what the ultrasound is really good for is detecting things like cysts and abnormal growths on the internal organs. And they can be very problematic, and they need to be dealt with medically sometimes, really important. They can find or sort of differentiate between cysts that might just be full of fluid and things like the kinds of cysts that you might get on your skin sometimes, or cancer, tumours. And so they're very important in terms of differentiating some of those structural abnormalities, or at least leading the doctors to maybe take a biopsy of an abnormal structure and see if it is cancerous. You've got things like spleen enlargement and potentially the enlargement of some of the other digestive organs as well. And then you have things like cirrhosis of the liver and fatty liver as well. It's where there's a lot more fat in the liver than there should be. Cirrhosis is where the liver is damaged. Then we also have things like gallstones, which are pretty common, right? Gallstones can develop, cause a lot of discomfort, a lot of sludgy material in the gallbladder, and the gallbladder can't function properly. The gallstones themselves can cause a lot of pain, and if there's a ton of gallstones and everything's really sludgy in there, the gallbladder's not going to be able to squirt out its load of bile properly, which can then affect detoxification and digestion as well. And kind of going hand in hand with the gallstones, blockages in the ducts between the pancreas and the small intestine, and the gallbladder and the small intestine as well. So these kinds of blockages can be detected by ultrasound. Now, as always with these medical tests, look, they're absolutely fantastic. The technology is incredible to be able to image all of this stuff and see what's going on in the internal organs. But more often than not, we have people contacting us who say, I went to my gastro specialist, I had ultrasounds done, I had an endoscopy, I had a colonoscopy. They put me through a CT scan or an MRI scan or whatever it might be, and they just couldn't find anything going on, anything that was wrong, and yet I have all of these symptoms. And so the major drawback of this test, as with many of the medical tests, is that it may not lead to the underlying root cause of the problem, right? If you have parasites and fungal overgrowth and really poor levels of digestive juice secretion, or if you have food intolerances, or if you just have emotional stress that's filtering down from the mind or the brain down into the digestive system, or nutritional deficiencies or low levels of friendly bugs and things like that in your digestive tract. This stuff just kind of looks at a different level of causality and might miss the real underlying cause of the problem. So that's the main drawback. However, with a lot of the testing that I run, and functional medicine testing and things, we can't find structural blockages. We can't find advanced organ damage. We can't find things like cancer and tumours. So it's not that functional testing is better or worse than, say, ultrasounds and colonoscopies and things. It's that they're both needed and they're both beneficial in the right context. Now, even if you've had these tests done and they've come back negative, it's still good that you had them done because it rules out anything serious, which means you can then kind of breathe a sigh of relief and then get cracking with actually finding out what the underlying cause of the problem is if it's just a functional disorder. So I hope that's been helpful. Again, the main gist of the video is this testing's fantastic, it's very helpful, but it may not get to the real underlying cause of the problem. So in the next video, we're going to talk about all the different scans that you can have done, and then we'll conclude by just looking at a big list of all the different tests and what have you, and the kinds of functional testing that you can do to complement the medical tests. So I will catch you next time, and thank you for watching.